one of the reasons I try and keep healthy and exercise is because the studies seem to show, and personal experience shows, that if you're feeling healthier, if you're getting enough sleep, if you've got a healthy diet, that is one of the contributing factors to keeping yourself away from the darkness that can come.
The main thing that I have to do really is watch my thinking. Now I meditate. I never would have thought that I would say that, but I meditate now. I do have a general approach to life of being mindful about my thinking. I can tend to rush through things, especially when I'm feeling slightly bipolar, so I know I have to slow down. I have to take my time, spend more time with my thinking. Don't necessarily act too fast. Just take a step back and breathe. Breath is a really important thing to me, just breathing through my feelings and my thinking before I have to do anything. And being aware that my thinking is not always a fact. My thinking is my thinking, and being mindful of that difference.
I do kickboxing, but that's in Springvale, and it's a bit of a hike from Richmond to Springvale, so sometimes I don't even go because I don't know. But when I am there, you know, your adrenaline's pumping and your heart rate's up and you feel good. And you feel good after. You feel like you achieved something.
There is evidence that physical exercise as a treatment is effective in depression. So it makes sense that if you have signs of depression developing, getting more involved in physical activity is a very good thing to do.
I think some of the simple issues are to avoid excess alcohol. We know that can bring on depression. To avoid illicit substances. For example, we know that if there's a family history that cannabis, grass, can lead to depression. So there's some of the simple things that can be avoided.
One of the biggest groups at risk of depression themselves are people who look after people who have depression. So that involves doing early intervention, making sure that you have a healthy lifestyle, making sure you get exercise, having some time out from being with the person constantly if you're feeling that they need that time with you.
I've talked with my fiancé, if I start to show symptoms that maybe I'm going to start having depression or having episodes, for him to be aware about what those symptoms are and to just drag me to the doctor if needs be, because I also know that, you know, Mum at times was very resistant to that because, you know, she doesn't want to cause any trouble, and as part of depression I may display that as well.
I think one of the big issues is to have a strong support network around us. Now that might mean our family, it might mean our friends, it's usually some combination of those. We need people around us, we need a sense of community, we need open relationships where we can talk about things, where we can unburden ourselves, you know, if we're worried about things. So strong social networks are very important, you know, as one of the protective factors to stop ourselves becoming depressed.
I think the biggest support group is my faith. I believe I could get better 99.999% because there are people there that won't give up on me, and they let me know that that I guess I matter.
There are ways in which we can prevent depression. So what we mean by preventing depression is that we stop somebody developing the first episode of depression. So the focus really is on the early teenage years to make sure that those who are vulnerable don't develop it. The techniques that we know work are to upskill people in how to manage their emotions. And there are various talking therapies, they're called, that people can use to learn how better to interpret the thoughts that they might be having.
one of the main areas that's been examined, that's been shown to be effective, is becoming more aware of our thinking styles, to become aware perhaps of becoming overly negative in situations, overly interpreting problems in situations. Also, how to become more resilient when we're under pressure.
A young girl might think she's ugly, stupid, dumb, and have fully internalised those views about herself. So whenever something happens that is a negative occurrence, she thinks, I'm dumb, I'm stupid, I can't manage this situation. So cognitive behaviour therapy is really about teaching her to be more realistic in her appraisal of herself. So you can imagine if you are thinking this way, you are more vulnerable to developing something like depression. Because it's a hard call on yourself. So people who develop depression often have these, what we call warpy thoughts, that aren't based in reality, but are firmly held.